Welcome to First Alarm Family First, episode 25. It has been a busy week, an emotional week, but our efforts when it comes to making a difference are not slowing down. Once again, I'm Jen Herrera, joined by Carolyn Acosta. Carolyn, another special guest today.
Yes, today we have a special guest, Melissa Riesgo. She is a dedicated therapist, founder, and CEO of Full Circle Therapy, published author of Lulu Goes to Therapy, and she's a host on her own podcast, Therapists Say, where she discusses mental health and relationships. And today we're going to explore how to better support our first responders, families, and how can we deal with the weights that they carry. Melissa, I'm so happy to have you here today. To kick off, what inspired you to become a therapist?
Yes. I first started off, I was going to be a nurse. I was very passionate about becoming a nurse when I was I probably 16, 17. I used to volunteer at the hospital, and that was going to be my career path. I started volunteering at the hospital, and then I got a job as a NICU secretary, and I absolutely loved it. I loved being there with the babies, and my aunt was the nurse manager at the time, so it was wonderful working with family. And I still have wonderful friends that are nurses that I met at the hospital, and I thought that that's what I was going to do. But I started to realize early on into being the secretary that I was a lot more interested in the parents that were at the NICU, and a lot of them were very sad, and their babies were in there for, at the time, I think if you got admitted into the NICU, they had to be there for 10 days. So they were really upset. And I remember like loving sitting with the parents and talking to them about like what they were going through, and they would cry to me about what they were experiencing. And I really loved that. So I tried to get into nursing school. It was kind of difficult for me to get into nursing school. And then I remember I sat with a guidance counselor, and she was like, "You have so many psychology credits." And I was like, "Yeah, I love psychology." I think all of my credits were in some sort of psychology. And so she was like, "You could really just change your major to psychology and graduate tomorrow." So I was like, "Okay." So that's what I did. I got my AA in social psychology. I got my bachelor's in psychology. And then I went on to do my master's in clinical mental health.
I imagine Melissa realizing that you had this passion, for psychology and choosing that career path. Somewhere along the way, you decided, hey, I want to do things a little differently. What makes Full Circle different?
Yeah, so I started Full Circle with my sister in May of 2020. So it was right at the beginning of the
Wow.
pandemic. Yeah, the pandemic was in March, and in May, I think, was when we saw our first clients. So I had been working from home for about 5 years before, now everyone works from home, but I was doing that for a while. I was working for an insurance company, and I was managing their intensive psychiatric patients telephonically. I would have to go to the hospital if they were admitted more than a certain amount of times, and I would see them, make sure that they had the resources they needed to not be Baker acted again. And so, but most of my job was working from home. And so I was doing that for a while. Then the pandemic hit, and I wasn't really able to do my job how I was for so many years, because now the kids were home. The husband was, he works at the hospital, so he was like in and out, but it was different. Things were changing, and my sister was graduating with her master's at the time, and she was looking for a job, and it was very difficult because a lot of it was telehealth positions. And I kept, I'm 7 years older. So I was like, you don't want to do that. And, we were trying to like bounce ideas back and forth. And I started to really struggle with anxiety, because I knew like if I didn't leave this job, they were going to fire me because my productivity was really low. And so I said, let's open a practice, like the two of us, because if I'm this anxious, like everyone else has to be this anxious. And so that's what we did. We opened a practice. We started with 4 therapists, and we started seeing clients. We became very well known in the community for basically the only practice that was seeing people in person because of the pandemic. And lo and behold, it was a lot of first responders that started coming. I think, some of my first clients when I opened Full Circle were firefighters, police officers, and nurses. I had so many of those. And when that started to happen, we we take insurance, but some of the insurances we didn't take, right? We take like the main ones, but there was a couple that we didn't take. And I started realizing that there was a lot of people that we were turning away that wanted in-person therapy, weren't able to find someone in person that, they connected to or that would specialize in the certain things that they were looking for. So that's when I decided to start alongside with our practice, the Full Circle Therapy Foundation. And that's what makes us a little different than a lot of practices in the community, because we do have that option where if someone comes to us and either doesn't have one of the insurances that we take, or maybe can't afford the copays or the deductibles if it's very high, we offer them to be seen by one of the therapists in the foundation. And the way that it works is we're partnered with Nova Southeastern University, and they send us students from their clinical mental health counseling program, and they're the ones that see those clients, and they're overseen by me and by another one of the licensed mental health counselors at the practice. And so I think that's what makes us a little different, is that I'm really big on having accessible mental health for everyone in the community that wants the help.
Yeah. You've worked with first responders for a while now.
Mm-hmm.
We know that they deal with a lot of trauma and stress. How does that all impact their mental health over time? What have you noticed?
Yeah. So I think at the beginning, a lot of them are very excited to, this is something that a lot of them have wanted most of their life growing up, or maybe they come from a family of first responders and it's like, they don't think twice about it. It's just, this is what I'm going to do. I'm going to follow in my dad's footsteps or my mom's footsteps. And they go into it very excited. And there's a brotherhood and a sisterhood that, we all know about, those of us who work closely with them or have relationships with first responders. And I think it just becomes part of their daily life, and it becomes normal for them, right? Maybe not so normal for other people who, maybe hear a story and are like, what are you talking? Like, how are you saying this so calmly? But it becomes normal. And then I think the way that maybe some of them start to cope with it becomes normal, even though it might not be the healthiest way of coping with the certain things that they're seeing. And over time, it just starts to build up. I think also just the trauma of seeing something terrible can start to build up within them. But I also think it could be triggered by their childhood. I'm very big on psychodynamic therapy, which is a lot about like going into your childhood and really trying to dissect that and see how it impacts us today. And so I think a lot of times maybe something will trigger them, or it really builds up over time. And that's, there's the complex trauma, there's complex PTSD, which is I would like to call it like little traumas piling up on each other that then gives you those PTSD symptoms. But yeah, I think that's what we're seeing a lot of.
But with that said, talking about the triggers, so yesterday, Carolyn and I were at the celebration of life for Captain Bill Guston, who passed away. He took his own life a couple of weeks ago. I think it's been about maybe 10 days, 2 weeks. I know firsthand that some firefighters, present or past, chose not to go to the service. I've overheard conversations, people on the phone, it's too much. I can't do it. I don't want to be there. What's that about? Is that a personal thing, Melissa? Is that fear of being triggered? What do you think?
Yeah, I mean, with psychology, it's everything is gray. Like there's so many different aspects of it that play into the bigger picture, right? And I think for some people it could be the too close to home feeling that might trigger some feelings that maybe I'm having, and I don't want to imagine myself in that situation. Or maybe again, something from their past or past experiences with loss and death and grieving.
So, my reaction to stuff like that, and all of our personalities are different. You just said it, right? Is like, no, you should go. Like, even if you're scared to go, even if you don't want to go, like, you should go. It would be good for you. You should be there. Is that wrong on my part for putting that out there like that?
Well, I think it has a lot to do with you. Like, I think looking inside of yourself and thinking maybe even when was the first time that I had this thought, right? Maybe it's even like as a child, or maybe your parents, or, what did your parents instill in you about being at these, or that probably has to do with loss, right? Or, going to funerals and such. Like, what were you taught, right? And then other people, I think, so it's, to answer your question, it's not wrong. I think it's like really like how you personally feel about it. But I think, again, it's so gray. Like, we don't know what someone else is going through, right? We don't know if, for example, I lost my cousin in December, and it was of natural causes, right? But I think I've struggled to attend sad things after that, because I'm like, I don't want to take more sad things in, right? And so I think for everyone, the reason might be different, and we need to hold space for all those different reasons.
Do you have any like effective coping strategies or that are therapeutic interventions that you would like recommend for first responders who
Yeah,
maybe?
so this is a very like hot topic, because I think when you're in like a moment of when you're feeling triggered by something, right? And sometimes you don't even know that you're being triggered. So it could be like either you're in a really bad mood and you're just kind of treating everybody like not the best because you're irritable and not in a good mood, right? In moments like those, if I tell my client, some coping skills like journal, deep breathing, go for a walk, listen to music, like all these things that I know, like off the top of my head, like the back of my hand, to offer as a coping skill, they're going to be like, Melissa told me to go for a walk. Like,
Right.
forget her. Like, that's the last thing I want to do right now. Right. So it's really hard to offer the coping skills when it's something that may not be realistic. So for me, it's really about getting to know my client, or, the individual, and really like what works for them. And so I think it's more about figuring out when you're not in distress, figuring out what is it that works for me, right? Me happy. Like, for some people, they have emotional support animals. They have a dog or a cat. I think you could see my cat right there. And so just knowing that, and knowing what makes you happy, right? And it could be as simple as the cup of tea. Like, I love my green tea. I don't know. Something like that. But I think it's having these conversations about, and someone doesn't have to be in therapy to like think of this, right? I think this is why these conversations are so important, because in regular conversation, I think it could come up like, I love, maybe I do love going for a walk. Like, I know, Carolyn, you are an amazing runner. Like, I wish I could run. I hate running. But so I think it's those things, like really getting to know yourself, looking inside, like what makes me,
You like
yeah,
stress or just you know go into your happy place?
yeah, absolutely.
I love that you just brought that out. I feel like this is a therapy session for me because I am
Love that.
like, especially the people who I care about. I'm like, why aren't you doing this? Like, you should be doing this. You'll feel so much better. Like, you should talk to somebody. You should. It's not about what I think they should do, right? Like, they have to find their thing. How is it okay to help somebody find their thing, or they just gonna find it in
Absolutely.
their own time? But then, like how for first responder spouses watching, how pushy is too pushy? How encouraging is too encouraging? Like, at what point do we have to say, okay, you know what? I'm waving the white flag. I've tried, I've tried, I've tried. At some point, you have to help yourself.
Yeah. Oh no, absolutely. And that's the thing. That's why I mentioned when I was talking about the practice, I love to help, and I love talking about therapy, and I live and breathe mental health. But if someone doesn't want the help, if they're not there, there's nothing that we can do. Like, we could sit here and until we're blue in the face talking about how amazing going for a walk and breathing in the fresh air is, and it's just in one ear and out the other. We're not doing anything. So to answer your question, I think it's more about the relationship. Like, it's more about building that relationship with your spouse And maybe it's not about like, oh, you need to go to therapy. Maybe couples therapy would help for, a few sessions. Not, and, some people think like, oh, I would never go to couples therapy unless that was the last resort. Of course, that's not what I think, because I think everybody should be born with a therapist. But I think it's about the relationship. Is your spouse feeling comfortable being able to open up to you? And they don't have to, sit there and tell you like the horrific things that they saw, but just even like, I'm not feeling good today. Like, it was a rough day at work. And instead of being like, oh, do you want to talk about the rough day at work? And I mean, you can say that, but most of the time they might not want to talk about the rough day at work. Instead, you can ask the question, do you want to go for a walk? Like, your spouse, what they like to do. If they like to go fishing, if they like to, sit in the backyard and just like look out at the sunset, so it's about those like, okay, let's do something together. Or, so I think fostering the relationship, fostering open and honest communication. And honest communication could be like, I don't want to talk about it. Like, right? So,
Yeah. So we can't forget about the kids. So I know you work with a lot of children too. So children of first responders, how would you support them? Because I mean, they at times don't have their parent there. It's a different dynamic.
yes, absolutely. I'm really big on being honest with children. And I have 3 of my own, 4 actually, with my stepson who's already 16. So almost an adult at this point, but I'm so big on just talking to them. And they could tell if their dad comes home or their mom comes home in a terrible mood, not wanting to talk to, sitting on the couch and just being completely, out of it, like needing to decompress. Like, they could tell. They could tell. And the thing about children is that they'll make up their own narrative in their mind, and it might not be the right one. It might be, oh, my parent is in a bad mood, like maybe I did something wrong. They have a wild imagination, so there's a lot of things that they could just come up with when it might not be true, right? So I'm really big on, if you come home and it's an awful day, saying, I had an awful day at work, I saw really sad things, I'm not feeling myself, and being honest about it. For the spouse, I think also verbalizing that. If your spouse isn't able to verbalize it, he's just not having a good day, if she's not having a good day, I think saying, mom or dad is probably had a rough day at work, or is not feeling themselves right now. Maybe we could do something nice for them, like, I don't know, make them like a hot chocolate or something. But I think that also teaches the children that it's okay to not be okay. Mm-hmm. We could do what we feel like we can do to help. If it's maybe like do something nice for them, or maybe give them their space, but just normalizing the fact that this is a tough job. It's very rewarding. I see they're heroes, like, like it's just amazing, but it is tough, and it's okay to know that, and to know that mom or dad see rough things and they might not be at their best every day, and I think we're also teaching them the same thing, that when they're adults and in that position, like, it's rough and we need to do things to help ourselves, right? So also having the children see that, like, and verbalize that, I'm not feeling myself, I'm going to take a little break, and then, we could do whatever you want to do, or whatever we're supposed to do.
The amount of sharing, I know, right, depends on how old the child is as far as the details of the sharing. I love this, that we're talking about this, because I remember as a kid, my dad sharing his firefighter stories, and they were all like kind of dark humor-ish.
Yeah.
Like he told the story of like a prostitute one night running down the street with like a pencil stuck in her throat, like not funny, horrible, but like he shared that story, and like I still remember that. And I remember hearing that as a kid. I remember hearing the stories of him, delivering babies, running into a house, and there's a teenage girl on the toilet, and thinks she's, having stomach issues, but she's delivering a baby. Like those stories I remember, right? I don't remember that baby lived, right? That's the story he told. He was able to save the woman running down the street. That part I remember. So he definitely sheltered us from the really bad stuff. My husband does the same thing now with our daughters, and he has bad days more earlier on in his career. So how honest should they be?
Yeah, so I think, of course, age appropriate. So maybe if we're talking about, I have a 6-year old and a 7-year old. So maybe to them, it would be more like he had a rough day, like he didn't, there was some, or even him saying, like, maybe the story about, like, I delivered a baby today. Like, that's something
Right.
appropriate.
Right.
When it comes to my older daughter, and she's 11, but, she's way beyond her years. So I think with her, we share a little more. She hears a lot of the things that I talk about with, either things that happen at work for me. And, I think with her, you can be more honest. You can say, like, there was a teenager, she delivered a baby, and, whether or not the baby survived or not. Like, I think that's something that is a reality. I think there's a lot of lessons just in that story alone that
Yeah.
I would take as like a learning lesson. And so, again, I'm all about being honest. Like, there's certain things that maybe like I won't tell an 11-year-old, and maybe I'll tell the 16-year-old. And so I think age appropriate, but I don't, if you have a good balance, right? If you also are telling them, like, look at this nice story about like who I saved, and then maybe you sprinkle in some like not so good ones. I think that is healthy and that's appropriate, and it's life, and there's a lot of life lessons to be learned. So yeah, I think that's
I think in having that open line of communication is huge. I think if Alex would have been a little more open of what he was experiencing, I think I wouldn't be here right now. I think things would be a little different, I would think. But I think that for now, like the spouses, yeah, talk to them. They need to open up. They need to tell you, not in detail. Like we don't want to see pictures, but know that, it was a really rough night and it did affect me. And I think that would change a lot. Just having, even with their own partners at work.
absolutely.
What I have a mental health, mental illness, mental wellness. I catch myself constantly when we're doing, these shows, and even when Carolyn and I, meet people out and about. What is the right way to say it? What is the wrong way to say it, Melissa? Because when we first started this journey, I was like mental illness, mental illness, mental illness. And now I'm like, I don't really like that anymore. Is there a right or wrong way?
There isn't, honestly. And I think it really changed, especially with social media now. It's like constantly changing. There's always like I always would say mental health, mental health. And then recently we redid the doors like at the office with our logos and stuff. And I put mental wellness on it. So I'm like, I don't even know how that happened. Like, just did. So I think it's constantly evolving. There is no wrong way, because when I was in school, we spoke about mental health as a disease. Like, this is an illness and a disease, just like diabetes. Like, right? We spoke about it in that way, and it needs to be treated and it needs to be talked about in the same way that diabetes is, right? So I come from that background as maybe like a little bit more of a medical model. And then now we're moving more into, it's very mainstream. Everybody's talking about it now, hopefully. But it's more common. So I think people are trying to normalize it. And by normalizing it, they're finding words that are more normal.
Yeah.
Like, well, but I don't think there's a wrong way. I'm all about, like, if you're talking about it, I'm happy.
If you could give like a key piece or advice to a first responder or their families, what would it be?
Advice to first responder families.
Yeah.
I think what I would say is that it could be scary to want to get help, because that means that you have to look inside, and that could be scary if you have to face a lot of maybe childhood traumas, is probably like the one that really affects people the most, that like sticks with us for our whole lifetime. And sitting down and talking about that and looking inside is really hard, but it's so much brighter on the other side, so much brighter. And so I think I would say it's scary, but we have to do it for the future, for our children, for our grandchildren. Like, it starts with us. right? We are the ones in charge of breaking the stigma. I talk about mental health to my kids like if it's, what we're having for dinner. And I see it. I see it happening. I see, my daughter asking me, "Oh, did you have therapy today?" Cuz I picked them up from school a little later, and it's just so normal. And so my hope is that my children do the same. Like they feel like they're starting to struggle, and they go and they get help. And then hopefully their children, they have a pediatrician and they have a therapist. So I think that would be my advice. Don't be afraid to get help.
Melissa, when a big burly firefighter, okay, comes in your office and, I don't know how this goes. You ask him why he's there and he's like, I'm just not feeling great or whatever. At what point, I'm just picturing men I know, specific one in mind. And you start with the childhood stuff. Like, I know some men are going to be like, what? Like, what are you talking about? Like, can you tell me the reluctance and how you get through that?
Yeah, it's all about building rapport and the relationship, the therapeutic alliance and the therapeutic relationship. So I can't sit there day one and be like, "Tell me about your mom and dad." Like, that they're going to be like, "No, like, who are you?" Like, no. So it's about the relationship. And, for a long time, I saw mostly men. I'm really big about men's mental health. And it's about the relationship. And it's the therapeutic relationship. I'm genuinely interested in your life because I want to help you. And, it starts off superficial. I used to say at the beginning, usually what they come in for is not like the real problem.
Right.
So you start off with what they come in with, it's superficial, maybe like it's something like, I'm really stressed, family life, work, all the things. And then little by little, you go like peeling the onion. Like, you said this, where does that come from? And that's how we get to the bottom of it. But, it really takes, I would say, like the first 5 sessions, you're not even got into like the root of it yet, depending on the person. There's some people that are like, here I am, here it all is on the table. Even the big firefighters, I've seen them, I've had them, I love them dearly, and we could get there quickly. But with others, it takes some time, and that's okay. I love to hear about their dog and their kids.
Yeah, I feel like it's the same for me. Like for me, it takes a while for me to open up to anyone, and it was the same thing, because I go to full circle therapy too, and it was a process. And then after that, it was like, okay, here you go.
Yeah,
Take it all.
yeah.
It's got to be like the best feeling ever afterwards, though.
Yeah,
it feels much better. Yeah.
mm-hmm. Mm-hmm.
Yeah, amazing. Melissa, thank you for taking the time to chat with us. This has been a lot of fun. It's been eye-opening. I think you just have such a great demeanor, and I feel like someone's going to be watching this and be like, I want to talk to her. I want to tell her everything.
Thank you so much. It's been a joy to be on with you both. Thank you so much for having me.
Yes, Melissa, thank you. And Full Circle's in Weston. It's amazing. I love that place.
Thank you.
Recommended. Melissa, thanks again. A reminder for everybody, if you see something, to sound the alarm.
Save a life.
I'll see you next time.